My name is Isela Aras, and I am the Director of Training at the Kentucky Coalition Against Domestic Violence. My work has been centered around ensuring accessibility to the domestic violence services available through our 15 member programs in the state. My section focuses on looking at the effects of domestic violence on children and elder abuse. So a couple of quick notes. Kentucky categorizes domestic violence according to the victimized population. This can refer to maltreatment of children under 18. This could include intimate partner violence, and it can include the maltreatment of someone over 50 years of age. With regard to children, one of the things that we're often asked with regard to domestic violence is, what about children? How can we make sure that children are safe or that children receive services? And I want to make sure that we all know that definitely those concerns about those risks are absolutely big ones, and that should be taken seriously. So we're going to talk a little bit about how those two needs, the needs of victims of domestic violence as well as their children, can be managed, and how we can ensure that we can provide services that account for the victimization that is happening for victims of domestic violence, while also taking care of keeping kids safe. So the risks for children are, just to name a few, are the exposure to traumatic events or neglect, or the risk of being abused, or the loss of one or both parents. This could mean higher ACEs scores. This can mean, with regard to the loss of parents, it could mean removal, foster care, separation, death, kidnapping, and a variety of other different ways that parents might not both be in a child's life. So obviously the stakes are high for making sure that kids are safe and that their needs are addressed as we look at addressing domestic violence overall. Because often we're going to find that victims of domestic violence needs and lives are complicated, and when children are involved, then that's going to add an extra layer of concern. When children are exposed to domestic violence, this can result in some pretty big feelings for kids. What it might end up looking like is that kids might struggle with high levels of constant anxiety. They might be worried about what was going to happen next. They might be worried about how they can prevent things. They might worry about how they're going to keep their parents safe. So this can mean not just anxiety, but also fear and guilt, because obviously kids may not have as much control over situations that their parents are struggling with. And so this might mean that they feel some guilt about what they are or are not able to accomplish being small little people. They also might have some mixed feelings about parents. It's really possible to be able to be afraid of my parent, but also to also love them. Or to be really upset with them and continue to love them. And so it's really important to help children be able to figure out how to address some of these feelings. They may just experience a loss of control of emotions, and that's with big reason, because these are big feelings and children aren't equipped necessarily to be able to manage them on their own. This could lead to conditions like depression, or even up to PTSD. And so these are really big concerns that obviously have medical ramifications as children grow older. In addition, this may affect their relationships. They might not be able to trust as freely as they might without experiencing violence. This might lead to poor self-esteem. And again, it just leads to a whole array of difficulties for kids. With regard to poor self-esteem, something that often comes up when we talk about domestic violence is the risk that poor self-esteem leads to people being at risk for being victimized. The reality is that when we're talking about adult victims of domestic violence, poor self-esteem is not necessarily a risk factor. What's a risk factor is that someone is in a relationship with someone who uses violence to solve problems or conflict in their relationship, and that is what leads to the poor self-esteem. So people aren't victims because they have low self-esteem. People may become victims, which then causes the low self-esteem. And so often that gets confused. It's like, oh, well, if people have low self-esteem, then that's going to mean that they're going to be a victim. It could be a result rather than a cause. So I often talk about self-esteem in this regard because, like, as we're looking at building kids' self-esteem, let's look at what that those healthy relationships could look like, so that we can try to offset as much of that damage as possible. So some of these big feelings, what might this look like for kids as we come into contact with them? This might mean a child that takes on parental roles in the household, or it might be that this is a really responsible child. This is the person who tries to take the kiddo that tries to take care of everything, that tries to solve problems, pre-solve problems, or manage conflict, or be a lot older than they might actually be. It might look like the overachiever kiddo. It might be the kiddo who uses perfection as a means to cope with violence. If I don't do anything wrong, then maybe violence won't happen, or maybe I can control when or if it ever does. This also could be the kiddo who learns to use violence to solve problems as well. One thing that we have to come to terms with is that we have to understand that violence is a problem-solving strategy. It is also a terribly effective problem-solving strategy. Does it solve problems well, safely, legally, often? No. But is it effective? Yes. And so children begin to learn that using violence can solve problems. And so it might look like the kiddo that we label aggressive, or who's an aggressor, someone who's seemingly easily angered, or aggressive with other children, or non-compliant. And interestingly enough, this is the category that is really fascinating to me, because when we look at non-compliance is really just another word for resistance, for I don't like what's happening, and so I'm going to resist with all of my little might. And so it might look like violence. It might look like a lot of aggression. And those things are absolutely real and absolutely reasonable given the circumstances, but they are also not as simple as they might seem on their face. And so when you are interacting with children or with families and parents, it would be a really helpful idea to start talking to them about domestic violence, screening for domestic violence, so that you're able to see what risks are in that family. So a question that often comes up is, okay, so I know that that domestic violence is a risk factor for this family, or that this is something I'm concerned that is present in this family. So what do I do? Meg is going to talk a lot more about House Bill 309 and the changes that made to mandatory reporting for domestic violence in June of 2017. But at the end of the day, what House Bill 309 did is that it changed so that mandatory reporting does not have to be reported among when it happens between adults. And the question that often comes up is that, well, what about kids? And so the question is, do I need to make a child abuse report if domestic violence is present? And that's a really big question to try to tackle. And so some things to keep in mind is that when you're considering child abuse reporting, especially when domestic violence is present, we should really be aware that the fact that a child's parent or guardian has been a victim of domestic violence is not in itself sufficient basis for reporting suspected child abuse or neglect. You should know as well that professionals are trained to be able to screen the circumstances under which a child abuse report will be accepted or screened in, depending on sort of the circumstances of that report. But the fact that someone is being victimized does not mean that they are abusing their children. A child's exposure to domestic violence incident in and of itself is not a sufficient basis for reporting suspected child abuse or neglect. The thing that comes up for me with regard to this specific point is that one of the protective factors for resiliency is actually a strong, supportive relationship with a parent or with a trusted adult in the child's life. And so the reason that we really talk about this is because if children are removed from a non-offending parent simply because domestic violence was present, then that literally creates additional harm rather than alleviating the harm that we are attempting to address. And so we need to be aware of all of the elements of the complex nature of domestic violence when thinking about how to create interventions that are going to result in children's safety. And in order to not penalize victims of domestic violence, viewing the non-offending parent and the children as a unit is important. This is probably the best suggestions that we can have for any professional looking at the risks of domestic violence and the concerns they might have for the children that live in that home. Again, and this allows us to be able to maintain those protective factors that might create additional will support resiliency for kids. If I'm able to ensure that whatever intervention I design responds to both the needs of the non-offending parent and the child, then chances are that those interventions are going to be healthier and result in the outcomes that we're hoping for. Not that we will always succeed, but at the very least we can make sure that we don't create additional harm. So looking at children as well as their non-offending parent as a unit is going to be a really helpful rule of thumb, because often what's in the best interest of a non-offending parent is actually what's in the best interest of kids. So we really want to be able to figure out what that can look like. In determining the risk and the need for an immediate response, you should consider whether whether there's been physical injuries, whether the parent is being threatened, stalked, coerced, or being assaulted or kidnapped by the perpetrator. If the non-abusive parent is being forced to flee and leave the children with the perpetrator. All of these things need to be considered because yes, they all do represent risks, but they are also going to inform what kinds of interventions we might need to design for that family. So when reporting has to happen, because our goal is not to say we should never report child abuse when domestic violence is present. We absolutely support the idea of keeping kids safe, anything that we can do to make sure that kids are safe. But we also want to make sure that kids live in an environment that is supportive and loving to them. And that might mean that the intervention needs to include a non-offending parent. For parents who are the offenders, it might mean that they receive a referral from DCBS or from intervening agencies for batterer intervention classes or domestic violence offender treatment. And we absolutely believe in providing whatever services are available to support a family's ability to live free from violence. So let's say that reporting is an inevitable outcome. And again, when in doubt, make the report. And so let's think about some possibilities of things to take into consideration if reporting is the route that has to be taken. Be open about why you are reporting. Talk to the person that is going to be dealing with the report and the fallout of this report. Because we know that when interventions are designed, this can create some interruptions and some disruptions in people's lives. And they also come with fear. And people react in really interesting ways when they're afraid, and they're afraid that they're going to lose their children. The reason that a lot of victims of domestic violence stay with their partners is that they are afraid of losing their children, losing contact with their children, losing connection with their children. It really is driven, that reason to stay is driven by children, their lives, their quality of lives, their connection to the people who are supposed to be supportive of them. So even their connection to an offending parent is important to victims of domestic violence. They are struggling to manage all of these conflicting needs and what they think is important for their lives, which there's no disagreement in that regard. We want families to be happy, healthy, and safe. We want kids to be able to grow up in a safe environment that cares and nurtures them. And so we need to be able to talk with people about why we have to report. This will encourage additional, it will encourage the therapeutic relationship. It will hopefully reduce the harm that will come to the therapeutic relationship, because if we're open with victims about why we have to make a report, it's less likely that they're going to see us as somebody who is just seeking to cause them harm. Ensure that you report accurately who exactly is causing the harm, who actually is being victimized. Document this, because it is really important to identify this, because if we call and say there's child abuse in the home, then that could lead to victims of domestic violence being penalized for something that is beyond their control. Victims of domestic violence do not have a lot of power and control in their own relationships just by nature of someone abusing their power over them. And so being able to understand that they may not have control over their child even is really important. So it's really, really important to ensure that you report accurately. This will also affect the any case plans that have to come from this report. And it helps keep people accountable in the ways that they must be held accountable. If someone is harming their child and harming their partner, then it's really important that their case plan look very different than a non-offending parent's. So accurately reporting who exactly is causing the harm is of the utmost importance. Plan for the consequences that may come as a result of reporting for victims. As a professional, you have within your ability to be able to plan for these consequences. Talk through what might happen. Provide some support and some resources for the person you are working with so that they feel a little better prepared for what might come. Is there going to be a home visit? Let's discuss that openly. So it takes, naming those things might take a little bit of the fear out of this really scary process for victims of domestic violence who are incredibly afraid of losing their children. Continue to provide support for non-offending parents. This might just be checking in on people, being able to schedule some follow-up appointments and being able to say, is there anything you need? Is there anything I can do? Is there any other information that I can help find for you that might make this a little less scary? So that as a professional, your patients or the people that you're working with know that they can count on you as a support, even though you have to do this really difficult, something that might cause them a lot of difficulty. Continue to advocate for non-offending parents. And this could be that you initiate contact with a caseworker that might be assigned to their case. This might be, let me share what my professional interactions have included with this family. This is just an extension of being able to report accurately who is causing harm, being able to provide context for what is actually happening in the family, so that the more information we have, the more accuracy we can report with, and more information we can provide, the better picture we can create, as well as better, stronger interventions that would actually support healthier outcomes for kids and families. Document your concerns, but also document the strengths of non-offending parents. You know, you can always talk about what people are able to do well in their parenting roles. Those things are important to be able to contribute a healthier, a better version of what parenting strengths someone might have. And again, this works to create complexity in some ways, but that complexity also helps to ensure that interventions that are designed for children both benefit the child as well as the parent who is really struggling to make sure that they protect their children to the best of their abilities. So anything that you can do to document your concerns as well as the strengths would be really, really helpful, because you are someone who carries a lot of weight in terms of being able to make your thoughts heard regarding what it is that parents might be doing better well. You know, at the end of the day, what we say about reporting is definitely, when in doubt, when you're concerned about children's health and safety, then make the report. But these are things that you can do to make sure that we can lessen the harm and be as accurate as possible. So at this point, we can move on to talk a little bit about elder abuse. So elder abuse is an all-inclusive term representing all types of mistreatment or abusive behavior toward older adults, and also defined as active commission and acts of omission in terms of failure to act. This could be paid or volunteer caregivers, medical or long-term care employees, family members, significant others, in some cases strangers, such as people who might befriend an elderly person for the purpose of exploiting them. A startling statistic is that 90% of elder abuse is actually inflicted by family members. And this excuse me, this might be because family members are often closest to elder family members and might be placed in a role of caregiving for them. So it's a really scary statistic because I know that we rarely ever get to the 90s of much of anything. So with regard to prevalence, adult protective services in 2012 saw 16,975 total calls, of which 7,728 met the criteria for abuse and neglect in terms of reports. By 2017, that had increased to 28,631 and 11,256 met the criteria for abuse and neglect. So as you can see, those numbers have increased over time. And so it really does not allow us to be able to say, oh, this is not a serious or an ongoing problem. With regard to how abuse may present itself, it very much mimics domestic violence overall. Often it can present itself in physical ways. This could be hitting, pushing, slapping, punching. This could be things like multiple fractures or bruises at various stages of healing. Frequent visits to the ER, delay in seeking medical treatment for injuries might also be something that you might see. Often when we talk about domestic violence specifically, but could also be something to consider here, is that when physical violence has made an appearance or has manifested itself in ways that people outside this person's life can begin to see, then you might be looking at an enforcement strategy. It's that coercion and threats haven't worked. It's that using intimidation hasn't worked. It's that emotional abuse that hasn't worked, or isolating someone. Those tactics of power and control haven't worked. And so we need something else to ensure that compliance continues to happen. And physical violence is often is a strategy used to enforce that power and control. And so it's really alarming to me whenever we wait until the manifestations of physical abuse begin to be seen, or that we begin to identify them, because it means that violence has probably already been happening to a pretty significant degree by the time it shows up and is visible. And the reality is that some of the physical, one of the physical manifestations or just some of the manifestations of this is actual just resistance. People don't like to be hurt and will do whatever is within their power to be able to avoid being hurt and to resist it. And so when thinking about the power and control wheel and those tactics of power and control and how they make an appearance, we also need to look for resistance, because the limitations of every model are that they may not show us what it looks like for someone to resist. With regard to psychological abuse, this can mean something like withdrawn behavior, wasting, failure to thrive, depression. Material abuse might be that there's an unexplained loss of income. This might mean loss of assets or lost assets, or things that are just no longer there that used to be. Loss of possessions, not eating, missed utility payments, things like this. With regard to sexual abuse, this could be any kind of non-consensual sexual act. Violation of rights. It could be deprivation of any inalienable rights, such as voting, assembly, speech, privacy, personal liberties, not letting someone drive anymore, or seeking out ways to limit movement. This could mean not letting someone attend church services or community events that they might, or be a part of communities that they might once have been active parts of. With regard to medical abuses, this could be no improvement in a condition for which one was prescribed medication, perhaps blood tests that indicate greater or lower expected levels of medications, excessive sleepiness, grogginess, things like this. Abandonment could include desertion of an elderly person for whom one has agreed to care for. This could be leaving a cognitively impaired elder at an emergency room with no identification, isolating them, not seen outside the home, or their home is in disrepair, might be unkempt in an unkempt environment. They might have missed medical appointments, or engagements, wandering, being left somewhere to fend for themselves when that is obviously not something that they're able to do anymore, or they have deteriorated to that point. Neglect. This could mean just a failure to provide necessary physical or mental care of an elderly person. This could be things like an uncared for appearance, inappropriate clothing, failure to thrive, lack of medical dental care, and just isolation. And these are just a few examples. I think that anytime, again, sort of like with child abuse, whenever someone is in doubt or has some concerns, then it probably is best to seek additional support to be able to, or making a report to be able to say that you're concerned about someone's well-being. So some risk for vulnerability. Some things to look for. It might be that someone's health has begun to deteriorate, or someone has suddenly become has a very poor health. They might be no longer able to perform activities of daily living. This could be as a cause of violence or abuse, or it could also be just the passage of time. And so, but that could be a vulnerability in and of itself, that it just no longer is something that they can do for themselves, which presents a vulnerability that we need to look at and pay attention to. Cognitive impairment, living with others. Although living alone does increase the risk for financial abuse. And so social isolation, depression, confusion, substance use or dependence, mental or physical impairments. Being female, interestingly enough, can be a risk for vulnerability. And being over age 85 can be an additional risk for vulnerability. And again, by themselves or in appropriate context, some of these things may just be, may be part of aging. But when there are concerns, then again, we need to look at deeper questions. Some risk factors for who might be perpetuating abuse. This could include a history of family violence, not necessarily because someone has experienced or has been a witness to family violence means that they're going to be an abuser of any kind. However, a history of family violence should be taken to be thought of as this is someone who may have learned that using violence was a way to solve problems, whatever that problem might be. That's what we're really looking for, rather than making connections that might not be as strong. Just because I saw violence, or even my parents struggled with violence, that doesn't mean that I necessarily will become abusive. Disruptive behavior on behalf of the care recipient. Again, this sort of speaks to power and control and entitlement, to being able to interrupt care for the recipient. Mental illness. I think this could have some stigma associated to it, but it could be more that this person is just not the person best suited to care for this individual, and we need to think about additional interventions. Caregiver dependence, stress, physical or emotional exhaustion. This is one of the reasons potentially that self-care could be a really important topic to explore. But what is it that, what supports are in place to be able to ensure that the best self of that caregiver is present to provide those caregiving services? And I want to stress here that when we think about self-care, it's important to think about self-care in the terms of structural supports rather than what's available to me. Because often the same difficulties that might be affecting the person I'm caring for might be affecting me as a person who could be a caregiver. For example, if poverty is something that is affecting us both, and I'm called to be a caregiver because of the poverty that my family is struggling with, then that might limit what my self-care looks like. Because when we talk about self-care, we do mean those external sources of stress, rather the things that are beyond our control. There's things that we can control. I can definitely take walks. Maybe I can exercise, yes, but those are not necessarily the best sources or the actual sources of self-care that we might need to look for. Now, this doesn't mean that we'll be able to do anything about it, but it's really important to be able to look at honestly what the problems that exist for those caregivers might be. Low social integration and or unemployment. Again, I think this unemployment element speaks to the effects of poverty on someone who is in a caregiver role, but also someone who might be in a place where they would have to rely on a caregiver, who might be a family member and who might not be in a good position to be a healthy caregiver. Again, lack of community supports and insufficient income for basic needs. I know that a lot of seniors are on fixed incomes. They struggle with not having enough income to meet their own basic needs or not being eligible for public benefits and things like this. So, excuse me, the last basically four, and maybe just the last half of this list really can look toward can affect what self-care can really look like for people, and whether it's an expectation we can actually have, and whether it's really possible or feasible for someone who is in a caregiver role. And not that this excuses violence or that defends actions, but it's really important to be able to identify the correct problems. Again, our interventions will be stronger for those correct identifications of problems. So what might some barriers to reporting be? And again, this looks a lot like what we're used to seeing with regard to victims of domestic violence. Victims may feel too ashamed to disclose abuse. They believe they're to blame or deserve the abuse. They have a dependence on an abuser who can make a victim reluctant to report for fear of how he or she will survive without the perpetrator's help. They may not define their situation as abuse when violence has been normalized. If this is something I've just had to survive most of my life, I might not see it as just anything different than what I'm supposed to figure out. There also may be cognitive, auditory, speech, visual impairments or restraints that make reporting impossible for the victim of elder abuse. It also might be that my caregiver, if 90% of caregivers are the perpetrators of elder abuse, it could be that I don't want to create additional harm to the person that cares for me, in terms of this might be someone I love, this might be someone I care about, and it's not a simple, straightforward expectation that people will be willing, ready, able to report. So being able to check in with people, asking them on a regular basis, creating that relationship that would encourage that disclosure is going to be really, really important, just as it would be with victims of domestic violence. Some additional barriers. Ageism can negatively affect detection of elder abuse. It's common for us to view elderly as confused or demented, trivialize elders' complaints, or just see it as something in the course of aging. Fast-paced medical services and heavy caseloads of social service providers may not allow for time for adequate assessment. And so as we think about it, we begin to understand that adequate assessment is really, really, really important, because there's so much that we can miss. Basic lack of information about where to turn for help impedes the intervention and treatment for both perpetrator and victim of abuse. Again, we have shelters that work with victims of domestic violence, but when we're looking at elder abuse, I don't know that we have specific places that we know of readily available to be able to provide the interventions that might be required to look at this as a specific challenge for our aging population. And also treatment for perpetrators. When we talk about domestic violence, we often talk about the risk that, or the challenge really, that we really have two interventions for victims or for perpetrators of domestic violence. We can usually do nothing or some version of that, or we can also incarcerate or confine people. And short of those two interventions, there's not a lot in the middle. And so we want to try to figure out how to provide something that really does support health and better outcomes for families in their entirety, even when that includes someone who has used violence to solve problems and who has caused potentially a lot of harm to a family member, whether it's in this caregiver role or whether it's in a partnership role. And so that's why the Batterer Intervention Provider Program is something that we are huge advocates for, because hopefully it does give us a third possible path. We don't have all of the answers when it comes to outcomes, and it's efficacy as a specific intervention, but given that the only two we have that are very clear, this third possible path might be an additional option that we can explore. And the same would go for caregivers who would be abusive in their caregiving roles. It could be that figuring out how to solve problems that don't require or that don't use violence to resolve those problems could be imperative and lead to a lot better outcomes. So in thinking about all of the risks and difficult challenges ahead, it's really important to think about safety planning, and what we are beginning to look at is harm reduction. I know that harm reduction is part of like the public health model, and so we want to look at, so the risk is elder abuse, child abuse, domestic violence, and so what do we do to reduce that harm? When we talk about elders, that would be stay sociable and active, in staying involved with friends, neighbors, church, community services or activities, getting regular medical and dental care. Open your own mail, increase social network as you age, have friends visit you at home, have a best friend with whom you can confide in. Keep in touch with old friends if you move. And a lot of these things seem like they're not really part of what we would ever know about with regard to someone's life, but it gives us a place to be able to have conversations with people when we're doing assessments. How many friends do you have? How many neighbors are you close with? Do you have regular medical appointments? Do you have regular dental appointments? How do you get there? Do you open your own mail? These can serve as a bit of a checklist for us as we try to figure out whether someone is the victim of elder abuse, whether someone is struggling with that, and so on. With one other note about staying sociable and active is ask about an elderly person's connection through social media. For people who are connected or use the internet and are comfortable doing that, it could be that their social network might be a little bit more virtual than it might once have been, but that could also be a source of staying connected. A lot of people use Facebook chat to be able to stay connected to their friends. And so while we look at it as just a thing, really the internet is a place to visit. Facebook is a place to visit. It's a place we go when we need things, when we need to connect, and when we need to practice some of our interaction skills with people that we care about. So that might add an element of sort of an additional support that they might have access to, but might not have thought of about in those terms. Keep your possessions organized. Tell someone you trust where your important paperwork and bank account information is kept. Have checks directly deposited into your account. I think this one is a really important one because this eliminates the risk of losing, especially for people where income is such a difficulty. Then being able to have direct deposit might not create additional problems such as losing someone's check, having to get those reprinted or replaced, which creates lag times and things like this. Use an answering machine to screen phone calls. Or don't leave cash or valuables visible. Notify police if you will be away from home for an extended period of time. Again, some of these things might be easier than others. Some of these might require additional interventions. But again, it gives you a place to start to be able to ask additional questions to gather information from the person you're concerned about. When thinking about keeping possessions organized, it might also be important to ask people if they have a will, if they have advance directives, if they have, in this day and age, again, if they have legacy contacts for their social media accounts. Places like Facebook have something called a legacy contact, which means, for example, if something were to happen to me, my legacy contact might be my sister, who is charged with shutting down my account or closing deleting my history or my browsing history, my Facebook accounts and things like this that I might want to have taken care of. Consult with an attorney. Make arrangements for the future, such as powers of attorney. What does that look like? What does that need to look like? What do you want it to look like? Get legal advice before making or signing agreements regarding your care or possessions. And I think that one of the things that we talk about with regard to domestic violence is normalizing the questions, normalizing the concern, normalizing the issue. I know that it would be really, I imagine that it would be really difficult to think about what's going to happen to me in advanced age and what the risks are. And I may not be in a place where I like to think about that. Most of us don't like to think about that. But again, talking about these things often and in a motivational interviewing kind of context to be able to say, this is just something I talk to everyone about. This is something that's really important for us. And I'm going to check in with you about it periodically. It's just something I really care about and want to make sure that everyone has an opportunity to talk about with us. Be aware of your financial situation. And again, this might be something that you are tasked with working through. It might be that you ask these questions to see where people are. Know where to ask for help. Find out about community resources before you need them. Definitively, we want you to know about our rape crisis centers and our domestic violence programs for whenever those are necessary and you need us. The other thing to keep in mind is that our domestic violence programs are incredibly creative. And so if that's one of your concerns, then you're always welcome to call us and we can help talk you through just about anything. Our domestic violence programs are super flexible. They know so much about the lives of the people that they serve, and they are so used to trying to figure out creative interventions and solutions that you would be surprised what the level of knowledge that they might be able to contribute to situations where you might be at a loss as well. So I would suggest that they're always a good place to start. But this can also include adult protective services, senior centers, mental health service centers, private counselors, clergy, local police, and adult protective services. Some additional resources for you. These are websites that might be helpful. The CHFS website has some really helpful information, Alzheimer's information, the Office of Kentucky Attorney General, as well as specifically the OAG's Victims Advocacy Division would be a good place to start. Should you ever need our domestic violence programs, please be aware that throughout the state, our 15 programs provide pretty similar services. Some of them are better at some things than others. They just have different skills, and but they are definitely willing to work on behalf of their clients. They all provide the same basic outline of services that include legal and court advocacy. This might just include attending legal proceedings with their clients, case management services, safety planning, harm reduction, support groups and counseling, housing assistance, job search assistance, economic empowerment programming, and tax preparation. I always list tax preparation because given that elder community might be struggling with financial abuse, it would be really important to steer them toward tax preparation services that will ensure that they receive the most that they can back. One thing you should be aware of is that AARP in Kentucky runs a volunteer income tax assistance site where they will prepare people's tax returns for free. They are trained by the IRS and don't have a charge. Refunds are direct deposited, and they are often advocates to be able to figure out any challenges that might arise from a tax return that's prepared with them. Usually AARP tax preparation sites are available from about mid-January through probably late April. And it's one of their biggest, most visible activities that I'm aware of. And so if you ever need to make that as a referral for people, that would be a really, really good thing. And should you ever have any information about any of the slides that I've shared here, any of the points that I've shared, you're always welcome to contact us and check in with us. We're always happy to talk through any problems that might arise or any challenges that you're looking at. So again, we're always happy to help you Google or work through problems. So thank you.